In this video segment, I want to take a moment and talk about the brain. As a survivor, your brain controls a lot of different things that you may or may not realize. It's important, whether as a survivor or somebody working with survivors, that you have a good amount of information and become what we would call brain informed. When we think about what does the brain control in day-to-day actions, everything from attachment and relationships to mood management to behavior, even discussing things like development, cognitive processes, learning how to walk and talk and speak, and learning how to manage ourselves, to build self-esteem, to understand who we are, and even our long-term development, which can absolutely be impacted by stress, toxic stress, or traumatic events. The brain in and of itself is the central focal point of everything that we do. By being brain informed and taking a moment to understand all of the things that go on, either as a survivor or as a professional, it gives us the opportunity to have a better understanding of what we're working with. First and foremost, understanding and knowing that the brain reacts and responds. Those are two different things. When we respond to things, there's a thought process, critical thinking, reasoning, problem solving that comes in that response. When we react, we do so out of whatever has occurred in that moment. There are three primary things that often will cause the brain of an individual who has experienced toxic stress or trauma to set off the warning of something's wrong. And those three things are vulnerability, a lack of control, and fear. When we think about vulnerability and that term and how it's presented across our world, there's a lot of different ideas of what that means. Vulnerability is not about who's strong or weak or who's right or wrong. Vulnerability is purely about courage. So I want you to think about it from a different lens. When you as an individual or somebody that you're working with is asked to put themselves into the ring of fire, that whatever comes at me, good, bad, stressful or not, positive or negative, am I in a position in that moment to handle it? And by handling it, meaning that I can take what comes at me and not be destructive. There are times in our lives that vulnerability is okay, even though difficult. But there are times, especially in a survivor's brain, where vulnerability is not safe. For me to put myself into that ring and take what comes at me means I'm allowing others to have control in what could occur. That's not a safe thing for me. So asking ourselves when we're working with individuals, are there vulnerabilities present? Are there things I'm asking them to do that require courage that they just don't have right now? The second thing, talking about lack of control. Control, again, is not about being in the right. Control isn't even about rules or limits. Control is not about getting to do what I want. Control is simply about a basic human need of knowing what's next. Do you as a survivor or those that you're working with, do they know what's coming next? Have you provided that for yourself or for others? Because as a basic human need, if it's not present, I'm going to retreat into my traumatic response systems. And the last one is fear. When we talk about fear, it's not about what you see or what I see. It's about what the individual experiencing the fear perceives. Do they see in that situation, no matter what it may be, that they see something that would result in them not being safe? You'll notice a theme amongst all of these is safe. The brain has to be safe in order to stay calm, to stay reasonable, to be able to stay in a state of critical thinking. All of this comes down to what we would call the traumatic stress response cycle. It has 4 components to it, and we actually feel it on a regular basis. It just usually doesn't impact us significantly. And that's ultimately something happens. Remember that when we think about trauma and the definition of trauma, it's any event. So when an event occurs, our body has an alarm system. It includes things like adrenaline and cortisol, which are chemicals within our system. And when those ignite and says something's wrong, then that alarm system creates stress. And as that stress increases, then our body will do one of two things, depending on what's in place. If I have the healthy, effective things I need in that moment, I will respond to that threat in a thoughtful process with critical thinking, and I'll be responsive to the situation, calm, cool, collected. But what happens when I don't have those things in place and that stress response kicks off? Then my brain sees the threat, perceives the threat, and will immediately react. And this is what we call our survival instinct. We all have it. It exists with everybody. It just plays out differently for each person. So with that said, I want to talk about the brain itself. I want to make this a pretty simple concept for you and what this looks like. So I want to refer to something called the hand model. This was designed by Dr. Dan Siegel. And the hand model is simply this. This is my brain. When my brain is functioning, it's closed. When it's not functioning, it's opened. When I am born, my brain is born this way. My thumb is, consider it my brainstem, my survival responses, my ability to breathe, to move, to function. Over a lifetime, and particularly in the first 12 to 16 years of our lives, we learn to cover up that response system. And what are we covering it up with? We're covering it up with what's called executive functioning skills. The ability to problem solve, the ability to calm, the ability to understand my mood and to manage it, the ability to ultimately manage my behavior and not be impulsive. Those are the core things that survival response gets covered up in. So when we return to that hand model and we talk about that survival response, what we're looking at is when I'm okay, I'm here. I can reason, I can problem solve, and I can talk through anything. I can hear you, I can process it. When I am under a direct perceived threat and these skills aren't working, I do what we would call flip my lid, just like this. And when that lid is flipped, these skills up here become ineffective, and now I am going to focus from my survival response in the middle of the brain. This is our survival response, and we call it flipping our lid. When we start to begin to understand how things work, we can do what Dr. Siegel would refer to as when we name it, we can tame it. If we get away from the fact that when I flip my lid and people want to talk about how I'm crazy or I'm psycho or there's something wrong with me, what happens if I come back and I say, you know what, I did flip my lid. I perceived a threat and I wasn't okay. Putting words with it can make it easier to handle. More importantly, the question is, how do we bring this back down? And what does it look like when I'm here? There are 5 core components most impacted when that lid is flipped. And that includes impulsivity, mood management, regulation, so just the basic ability to calm mind, body, and brain, and problem solving. And when I'm here, my auditory capabilities, my ability to hear you and process the words that you're saying is gone. As human beings, we fix things. That's what we do. And so when people are threatened and their lid flips, what do we want to do? As a survivor, I want to fix it right away. As a person working with survivors, I want them to fix it right away. So we start problem solving immediately. Well, the problem is, I just told you, everything that you say to me, I don't hear. I'm not processing the words that you're telling me. So everything goes in one ear and out the other, and I just continue to escalate. So I want you to consider, when we start talking about survival responses and how do we do these things, I want you to really consider those key areas of impact. If their lid is flipped, am I asking them to problem solve? Am I asking them to regulate? Am I asking them to manage their mood and to critically think about what's being said? Because I'm wasting my time doing that. Instead, what I'm going to ask you to do is to change your responses. Human instinct is to fix, to check in, and then take a break. That's what we naturally do. And I'm going to ask you to flip that. As a survivor for yourself, or as somebody working with a survivor, if you want me to go from a flipped lid to a closed brain, you have to help me do that. And the way that we do that is when I am flipped, I need to regulate first. I need to calm my mind, my body, and brain. What skills do I internally have? What skills do I externally have? What can the individuals around help me with, model with me, and practice to help that calm? When that calming occurs, I'm halfway there. It doesn't stop there. From there, I have to know that I'm okay, that you're okay, and that we're okay in this moment. And this comes back to relationships. Are we in an okay place? Is it safe for me to return to that closed brain and allow my critical thinking processes to start again? This is what we call the 3 R's. My lid is flipped. I need to regulate. I need to address relationships. And once I'm there, I can reason all day long. I am telling you now that this is the opposite of your human instinct and the human instinct of everyone that you work with. It takes time, it takes practice, and it takes modeling to make these things happen. So with all of that said, I want to prove this to you. So on your screen right now, you are seeing a picture from the Center for Disease Control. And on this picture, on one side, you will see the workings of a brain that has minimal exposure to trauma. You'll see that there's lots of colors within this pictures of reds, greens, blues, and yellows. Each one of those color spots is active functioning within the brain. Now, if you look at the other side of that, this is the MRI imaging of a 3-year-old's brain. This is a 3-year-old that has had abuse, neglect, and household dysfunction present within their life. You'll notice the differences. The entire middle part of that brain is not actively lit up anymore. Notice at the brainstem, the back side of that picture, notice how on fire it is. That is my proof to you. When we talk about trauma and we talk about impact on the brain, it is a brain injury, not a choice. So what I would like you to take from this ultimately is that there are things that we have to do, and more importantly, there are things that we can do to make this process work better. This is what we would consider being brain informed. Taking this information, understanding vulnerability, control, and fear are the 3 things that ignite that survival mode that will flip that lid, and that there are 3 things you can do to close that lid. And that is focusing on regulation, focusing on relationships, and then focusing on reasoning. This is not an easy process to do, but if you don't do it, things are just going to continue to escalate. Consider what that looks like for you.